There are some important differences in the abdominal exam of a child versus an adult. For example, children have a small and underdeveloped stature. Because of this, their intra-abdominal organs are smaller and need deeper palpation to accurately identify abdominal organ pathology. Also, children often do not express pain as well as adults. It may be necessary to indirectly ask them about pain and pay close attention to their facial expressions and body language. First, be sure to get consent from at least one of the child's parents before the exam. Most importantly, introduce yourself to the child. Talk to them and make sure that they feel included in the discussion. Remember to keep the parent in the room when performing a pediatric abdominal exam, as this helps keep the child calm. A pediatric abdominal exam includes the same 4 components as an adult's abdominal exam. This includes inspection, auscultation, percussion, and palpation. To examine the abdomen of a child, start by doing visual inspection. So, examine the contour of the abdominal wall. Look for any signs of distension that might indicate ascites or organomegaly. Look for any asymmetry. Notice for any pulsations. Notice for any skin changes in the abdomen. Look for scars, discolorations, or striae. Inspect the abdomen for any visible masses, and observe the abdomen for wall motion with respiration. The provider may need to skillfully distract a child to auscultate and percuss the abdomen. This may not be an easy task in an active, uncooperative, or crying child, but it is an important step. Make sure that the child is in a calm environment, then help them to sit still by using a distraction such as a small toy. As you would in an adult patient abdominal exam, listen to the 9 regions and 4 quadrants of the abdomen. With younger children, do not forget to use the bell of the stethoscope. Next, percuss the 9 regions and 4 quadrants of the abdomen as you would in an adult exam. Tympany and dullness during percussion, as well as fluid waves and shifting dullness for ascites, can also be elicited in children. To help the palpation go smoothly, the child must be in a comfortable position. Ensure that the parent is present and prepare them for palpation. Sit on a chair by the bedside so that your face is level with the child's face. Ensure that the abdominal wall muscles are relaxed by having the child laid down with their hands at the sides. Completely expose the abdomen and cover the rest of the body with a blanket or a sheet. Have the child take in a deep breath and exhale completely before palpation to help relax the abdominal wall muscles. Palpate the abdominal regions and quadrants using one-handed technique in younger and smaller children, or a two-handed technique in older or more adult-sized children. Communicate with the child throughout the exam, but avoid words such as pain or hurt, since they can make a child fearful or upset. As previously mentioned, an alternative method is to observe the child's body language and facial expressions to determine if they are in pain. Apply deeper pressure to assess intra-abdominal structures. Relaxation of the muscles is important